Hello. Is there a delay? No, it's okay. Good morning. It's Rita at Gold Medical Jobs. Thank you for tuning in here at Facebook. And happy Monday. I hope it's a happy Monday. The date is the 5th. It's one of my nieces. Happy birthday. So, Gold Medical Jobs, we're here for you at Facebook. We tune in, I tune in, this is Rita. I tune in every Monday, Wednesday, and Friday. This is the first week I'm coming to you at about 10:30. I was trying to get the technician in here earlier. I couldn't get him early, and so it took a little while. And so it's 10:40. But we will be here Mondays and Fridays at 10:30. And Wednesdays will continue at 1:30, and that's all Pacific Standard Time, although we can reach you anywhere. So I just let you know the times here so you can plan accordingly if you want to be here live with us. So far, the video chats are planned. I usually have Mary as a guest on Wednesdays, but I'm hoping at some point that we can chat, that you can check in with me and chat as we are going live. We've gotten a lot of likes, so thank you for that, and some suggestions, mostly about specific jobs. So that's great. That's what we're all about. We're trying to connect healthcare employees with healthcare employees with healthcare employers. So that is the purpose and mission of Gold Medical, is to connect every facet of healthcare with one another. I can't believe that fax machine is still talking to me. So you can reach us through Facebook, Twitter, Instagram, and LinkedIn. We are at www.goldmedicaljobs.com. And then just below my face here, you see my name, Rita, with an email. I'm the Chief Nursing Officer for Gold Medical Jobs, and I've been a nurse for pushing 100 years. I started nursing in the 70s. So, and I still love it. It's still fantastic. I've had a lot of different opportunities over the years, and from my nursing school days, when I was just trying to do anything that had to do with patient care, to present, where I do volunteer work and some clinical work, and mostly nursing admin at this point, but a lot of clinical nursing in my background. ICU, med-surg, home health, dialysis, acute dialysis, interventional radiology, cardiac cath. So lots of wonderful experiences, and I usually try to share some little clinical highlight each time. So I'll make sure before this video ends that I share a little nursing story with you. They're sometimes funny, sometimes not so funny, but they are real stories from real nursing. So there's that. Sometimes I hear noises and I don't know if they're coming from the computer or from the world around me. And that one was from the world around me. So we have been talking quite a bit about recruitment. We've had videos where we talked about branding. We've kind of gone through the do's and don'ts. And I don't know, where do I want to go? Where do I want to go with you right now? We've talked about it from patient perspective. I've shared with you some of the experiences I've had with my mom. My mom is handicapped from a very big stroke she had. She's in her 91st year. She's pretty amazing, very cognitive, but has a major deficit. It's called a left hemistroke. And so her entire right side, from top to toe, is paralyzed. She has had enough rehab determination that she can hitch and transfer safely on her own for the most part, but she cannot move her arms, her toes, her fingers. Yeah, she has actually some contracture in the right arm, and but still leading a pretty viable life. So that is a blessing. I think the connection between employer and employee warrants multiple discussions, and I think I'd like to hear from people about their employer-employee interactions. And I think actually we can't ignore what's been in the news. We had a pretty tragic weekend starting on Saturday in El Paso, Texas, with a shooting in a Walmart where there were 3,000 people shopping, and at least 20 were killed and many, many more seriously wounded. And then the very next day in Ohio, another shooting. Gosh, I can't remember where that was, but there were deaths involved. The gunman's sister was shot and killed, I believe. So, so I think life throws curves at us, and guns are certainly dangerous. And I've had some sharpshooting lessons with guns. We never did purchase a gun in our family, but we thought if we ever did, we needed to know how to handle it. And being parents, we'd need to know for our children and grandchildren. So yes, they're dangerous, and yes, there are deaths, but when you look at deaths from auto accidents or accidents in general and illness and so forth, it is a small piece, but it is an impactful piece, and we hear it on the news and we see it on the news. And I apologize, I'm still in my my hiking clothes. So I guess what I wanted to pull from that is certainly how sorry I am for people that have such tragic and horrific losses, but also that the result, the teamwork that occurs with the first responders, with the SWAT, with the government officials, with our president, that's a well-oiled, well-greased machine that responds. And so it's not an easy an easy comparison to working in a healthcare setting, but in any setting. So for example, my mom, who's in an assisted living facility for seniors, that also has a memory care and rehab and skilled nursing. It's an all-purpose. It has independent living, assisted living, rehab, memory care, and skilled nursing. So you could have an injury or illness, need some rehab, or need the skilled nursing, and then get right back to your apartment. So it's all there in the same complex, which is really terrific. And it's in a really convenient area close to stores and dentists and the like. So for her, that's great. But what are their systems? As a matter of fact, I'm getting ready to interview with them again, or confer with them, because my mom has lived there a little over 3 months. She lived somewhere else for a year, and then prior to that, she was actually living in her own home, but didn't have access to what she needed quickly enough if she should fall. And she fortunately has had some falls without major injury, but it was getting kind of scary. So we were able to convince her that this was a better move, and she's adjusting slowly but surely. When you feel better, it's easier to adjust, and she's had illnesses this year, so respiratory really knocked her out. At any rate, I guess the point I want to make is that systems need to be in place. So in that case, in a big Walmart, what's the system? And then within the Walmart, they have McDonald's, people dining, they have restrooms, they have outdoor, they have at El Paso, they have an outdoor gardening area. So if you have 3,000 customers and you probably have more than 100 employees in there, what's that process? What's their emergency preparedness plan? You know, who's in charge of grabbing the first aid kit? Who makes the first call, or who's nearest, and who knows where to go? So say there's a fire at the front door, the gunman is at the front entrance. What is the plan? So those are things that warrant discussion, practice, and more practice. So a program is created, and then people practice it, then they fine-tune it, and then I'm sure right now, after this terrible, horrific weekend of shootouts and deaths and injuries and trauma, that they will relook at that and see what they did right and what they did wrong. So here's the thing about that. If missteps were made, or if protocol wasn't followed and outcomes were not as good as you could hope, then you take that information and you learn from it and you improve on it. So it's not complaints, concerns, errors, missteps. They're not the worst thing in the world. It's called being human. But, you know, making them over and over is not a great plan. And so what I want to say to employers and employees is to reflect, to review, to improve, and, you know, finger pointing and blaming is just really not that helpful. We make these mistakes because we're human. I was at my friend's house, and her dog is a very excitable dog, and I don't know what it is, part poodle and part terrier, and cutest little guy. His name is Duke, but he's met me numerous times, and he jumps all over me, and he chews on me a little bit. He chews on my fingers when I go to get him to go down, and so my response is Duke, Duke, and getting louder and louder. And then my friend is saying to me, he doesn't respond to yelling. Correct. Who does? So, so I guess take a breath, be calm, and review and retrain and improve is so helpful. Okay, so I am really grateful to first responders. I am really grateful to those that not responders, but you know, just lay people that were involved, that did the right thing and did the brave and courageous thing and protected others, particularly children and infants. How wonderful. And so some of us are just braver and more courageous than others. I don't really believe I'm that brave, but I have a lot of knowledge, and I have been a nurse for a long time, since the 70s, the 1970s, and I can remember, particularly my ICU days, but you know, right up until my current clinical practice, that people said, "Oh, you were so calm," and I'm grateful that that's the perception, because I'm anxious, and you know, somebody's heart stops, or a lot of bleeding occurs, or a procedure, something gets nicked or dropped or whatever. Like my more recent clinical was in interventional radiology, and sometimes people choke or gasp, or their breathing is impaired, or their blood pressure drops. And so sometimes emergent meds and emergent treatment is needed, and having that knowledge in your back pocket and applying it and communicating well with the team is key. And so you kind of go into an automatic, right? So if you're in traffic and you've got a green light and you're going, but all of a sudden you recognize that other people are stopping, you start looking all around and putting on your brakes. You have to respond. Do you know what to do? I don't want to crash into that car in front of me, so I am going to start to apply my brakes and maybe, flick my high beams so other people know that I'm going to be stopping or whatever. So you put those things into practice, and unfortunately, it's what do I want to say? It's reassuring to people around you when you apply the right practice when needed. So, I'm grateful that people thought I was so calm as I was pounding on someone's chest or applying paddles or intubating or whatever, calling codes, etc. So I'm grateful for that. I guess I have a poker face. So that is something I just wanted to mention to all our healthcare people, that yay and hooray that you have that information and that knowledge and you can put it into practice. And to employers, yay and hooray for having your emergency preparedness and your practices and protocols for the non-everyday things, for the things that may occur on occasion. I mean, fire can happen. Mother Nature can pull tricks on us. Certain parts of the country are more prone. Texas, boy, they have weather, don't they? Big giant state. So I just thought I'd bring that up because that's been on my mind, and in the newspaper, and in the daily news for the last 3 days. Probably be there for a few more days, but I also want to say that our everyday life, to walk around with fear and angst and anticipate bad things all the time isn't healthy, isn't good for our body and our soul and our mental health. So having those practices and standards and protocols in place should be somewhat reassuring. And having team members that you can rely on should be reassuring. In any of those cases where I had to apply paddles or call the code or, prepare to intubate and, the crash cart, the whole deal, how wonderful to have team members that also come. What's needed? Oxygen, call the anesthesia, whatever. So to have those team members is absolutely reassuring and helpful. To have all team members on board. In the hospital, they have those they have code teams, and they have, oh gosh, it's been a while since I've been practicing in a hospital. What am I thinking? The STEMI code team, the code blue team, and then there's all different colors, silver and red and black and orange. So terrorists, we're prepared for terrorism, we're prepared for fire, we're prepared for, what am I going to say, those harmful hazmat emergencies. Yeah, so where my mom is, this residence, where she's handicapped, she's in a motorized chair, they have to have a system in place to, gather the people that are mobile and ambulatory, and then another plan in place for the people that are bedridden or, slow walkers with walkers, or like my mom in a motorized wheelchair, maybe not in her motorized wheelchair. If it's charging, she just might be in a wheelchair and need somebody to assist wheeling her. So there's so many facets to being prepared for emergencies, and how wonderful to have a plan and to go into that plan of action when needed. So I thought I'd bring that up. And then I always like to tell a story. So let's go into the archives of my old memory. Oh gosh, I always think of things and then forget to jot them down and then get involved with technology. And What do I want to share with you? Hmm. I like the funny ones better. Um, and then, you know, the ones with blood squirting and so forth. I'm not sure if I told you this story, but I guess this is a good one. This occurred in a hospital setting. It was maybe a telemed surge unit. I can't remember if this patient had any cardiac issues, but she had a nickname, and interestingly enough, her name was Anne, but they called her Aunt Annie, and you'll find out why. So I was coming on for a morning shift. It was way back, good Lord, in the 80s, I believe, and was I the 3 to 11 shift? I think I was the 3 to 11 shift. So back in the 80s, more often than not, hospitals were on 8-hour shifts for nurses. So we worked hospitals and nursing facilities. We worked 7 to 3:30. So from 3 to 3:30 was report time and changing of shifts. So it was 7 to 3:30, 3 to 11:30 at night, and then 11 to 7 a.m. in the morning. And we always overlap by at least a half an hour. I think in the skilled nursing facilities, it might not have been an overlap, but a shorter overlap of 15 minutes or something. But that's how we covered the 24-hour period. Now we do the 12s, so it's 7A to 7P, 7P to 7A, and so forth with that half-hour overlap. So at any rate, I was working the 3 to 11 shift and receiving report from the day nurse. And I think the way we were doing it at that time was we'd get a little verbal report at the nursing station. So back in the 80s, you might have had 5 to 7 patients, depending on if they did indeed have telemetry and cardiac monitoring, or if they would med surge. You know, based on their critical needs was how they planned your assignment. So I received my assignment. I was getting report from another nurse or 2 or 3, depending on the group I had. And then we'd try to make a quick trip to the bedside. The night nurse would say, "This is your day nurse, Rita. She'll be helping you today, and she'll be back shortly. We're going to go to the next room." And so that's how we do. So you get an eyeball. You see the IV is running functionally. The patient was alive and well. And it was just a quick hello, look-see, and then on to the next patient. So I get to this patient known as Aunt Annie. And I'll tell you why her name was that, because Aunt Annie fell in her home. She was in her mid-80s at least. And in her home or her garage or her front, anyway, she went unnoticed for a while and she became infested with ants. How awful. So, so that was part of her condition. And then she was being, monitored neurologically and physiologically and to make sure she was okay. I don't think she had any broken bones and so forth. So they gave me the update when she'd been admitted, what was going on, and then we went to the bedside for that quick hello and look-see. And I say, "Good morning," and something seems odd. Something just seems so odd. And I said, "Are you feeling all right?" And I went to her covers to adjust them to kind of get a better look. And she had one arm completely missing. All that was left of her shoulder was this little skinny clavicle, right? This little skinny clavicle and nothing else. And I was stunned, and that hadn't come up. I mean, if somebody's missing a limb or an eyeball or a toe, it's good to let the next nurse know. I mean, that's going to affect balance and so many things. And it was from it was not from this admission with the ants and the passing out, but it kind of blew my mind. And so, yeah. So it may not be an admitting diagnosis, but it's significant when somebody is missing their entire arm, and all they're left with is a clavicle. So yeah, that was I don't even know when that was. I think that was in the 80s. So I guess it's just share the the most important things. Please share the most important things, even though it may not be a critical issue, it may not be part of the treatment. It just helps the next person be more prepared to meet somebody that has something missing, something pretty big missing. But an eye, a nose, an ear, finger, or an entire arm, or an entire leg. Yeah, good to mention that. Okay, so I will see you on Wednesday at 1:30. Mary will be with us, and we'll focus more on recruitment. I think it's really key to what Gold Medical is all about. Gold Medical Jobs is here for all facets of healthcare, and our job is connecting healthcare employers and healthcare employees and helping you find the right niche, the best match. And please visit us at www.goldmedicaljobs.com. Lots of information there, lots of, what do I say, we will nudge you on that site on how to put in your profile. There's little cartoons, and it's a really, for me, who is not, maybe the world's worst technician, but I can barely navigate. There's lots of help navigating the site, so that's what I wanted to say. And thank you, everyone who visits us on Facebook. We really enjoy visiting with you, and I can't wait till we can interact together. I do believe the site now has a map, so you can look for jobs in various states, and I think that'll be fun. And we will be back with Mary on Wednesday, and then again on Friday at 10:30. So I hope 10:30 works for you. We usually hear from 20 or so minutes. We did start a little late today, so I know we're pushing 11 o'clock. I'm sorry to keep you, but have a wonderful week. Stay safe, stay positive. Take care of yourself, and take care of one another. Okay. So good health. Thank you.